Imagine hearing the word cancer from a doctor. The fear, the confusion, and the overall overwhelming anxiety that can follow can leave you completely shocked and paralyzed. Now imagine a dedicated health professional who steps in not just to manage the complicated medications needed to fight that cancer, but who also serves as a beacon of emotional hope during one of the absolute darkest times in a person's life. Today, I'm going to talk to you about the important role of oncology clinical pharmacists. My career goal is to become an oncology clinical pharmacist myself. I've spent a lot of time researching the incredible impact these specialized professionals have on patient care and recovery. Almost all of us have been touched by cancer in some way, whether it's a family member, a friend, or a coworker. The impact of this disease is widespread, and having an understanding of the support system available during the treatment is important to all of us. Today, I will talk about the important role of oncology clinical pharmacists by discussing how they ensure patient safety through managing medication, how they how they provide essential emotional support to ease anxiety, and how combining these skills improves the patient's overall quality of life. To really understand their impact, we're going to first look at the important role they play in managing the physical side of cancer treatment. I will first discuss their specialized training, how they actively manage patient treatments. Oncology clinical pharmacists ensure patient safety by providing medication guidance, managing complex treatment schedules, and making sure they reduce the severity of side effects. These pharmacists have highly specialized training to deeply understand the complex cancer medications, how they interact with the body, and the specific side effects the patients might face. Because cancer treatments are not just one pill, pharmacists help patients keep track of their highly complex medication plans that include both at home oral medications and in clinic IV treatments. For example, according to a 2024 article published by Geisinger Health, these pharmacists work directly with doctors to adjust treatments and help manage chronic conditions to ensure patient safety and comfort. Furthermore, a 2022 report from ASH Clinical News highlights that pharmacists are fully integrated into a healthcare team. They independently screen for complex drug interactions and monitor lab parameters to catch severe side effects before they even happen. So now, here's my visual aid. My visual aid is a slide that's separated into two sections. In this section, the blue section is a clinical side of pharmacists do. They make sure that the patient's receiving the proper treatment, the proper medication, and they make sure that they're receiving during the right times, and that they're also improving. But it's cancer we're talking about. So cancer isn't always just about treating them. It's also about giving them emotional support. That's why these pharmacists are so important. The emotional support they give could dictate how a day goes for them, even if it's just saying how they're doing, right? So here we have the emotional section of the slide. They check up on them. They ask their name. They talk about their life stories. They want to get to know them. That's their goal, and that's the important factor of the dual jobs that these pharmacists have. So next, I will explain how they build personal relationships and educate patients to reduce fear. Oncology clinical pharmacists give vital emotional support to help calm patients and control their anxiety. The practice of oncology pharmacy requires a deliberate balance of clinical precision and deeply personal relationship. These professionals do not do so much more than just count pills and dispense medications behind the counter. They actively educate, reassure, and truly listen to the patients. In a 2024 article in The Oncology Pharmacist, Jay Dury notes that by knowing their patients by name and understanding their personal stories, oncology pharmacists help support patients and caregivers through their fear, offering them hope throughout their entire journey. By combining the clinical communication with genuine empathy, pharmacists become a vital source of personal reassurance during a terrifying time. This combination of physical and emotional support naturally leads to a better overall outcomes for the patient. Finally, let's look at how this education and direct intervention leads to higher patient satisfaction and treatment success. The combination of medication expertise and compassionate care helps improve patient adherence to treatments and enhances their overall quality of life. Pharmacists help patients by providing education, constantly checking in with them about their therapy, and stepping in to minimize major barriers like the astronomically high drug costs or managing challenging physical side effects. This direct involvement has measurable positive impact on patient success. According to Galler's 2020 article in Pharmacy Times, studies show that patients who are involved in pharmacist-led clinical interventions experience higher positive outcomes, such as higher medication adherence and greater overall satisfaction with their care. Ultimately, this targeted care reduces the comprehensive burden of illness, drastically improving the patient's day-to-day quality of life. Overcoming these logistical barriers and closely monitoring therapy ensures patients complete their patients safely and successfully. In conclusion, the role of an oncology clinical pharmacist goes far beyond this simply dispensing medicine. Today, we explored the dual enrollment of oncology clinical pharmacists by seeing how they ensure patient safety by independently screening for complex drug interactions, how they provide vital emotional support by building personal relationships to ease the patient's fear, and how they direct interventions like minimizing the burden of high drug costs, ultimately improve the patient's adherence and quality of life. So the next time you think about that terrifying moment when a patient first hears the word cancer, remember that they do not have to face that darkness alone. Oncology clinical pharmacists don't just fill prescriptions, they prescribe hope, serving as that crucial beacon of light we discussed earlier, and proving that human compassion can just as important to us healing as the cure itself. Thank you.